Give now a floor to our youth delegate, Bryan. Please, you have 4 minutes.
Honorary President, distinguished representatives, and my fellow youth delegates. Amidst the pandemic, I served as a healthcare worker and a medical student on the front lines. In my role, I battled two challenges. The first was the virus, needing to save lives of patients in intensive care. The second, navigating the proliferation of false and misleading stories shared without background or quality checking. Over the next few minutes, I will outline the changing nature of mis and disinformation, how it detrimentally affects children and young people, and the recommendations I call on the Congress to consider. But before I do, I would like to share the story of one of my patients, Amina. Amina was like me, 20 years old. She dreams of becoming a journalist, of traveling and helping others. When I saw her, she was suffering from the effects of coronavirus. She was in a critical condition, having lost function in one of her lungs. Amina needed further care, or she would die. However, she wanted self-discharge because her family had read on Facebook and through WhatsApp if she stayed in hospital, she'd be poisoned. Amina was frightened. If she passed away in our care, we wouldn't tell her parents. She didn't know what to believe and wanted to be back home, even if this was a death sentence. Clinicians were forced to accept high right to decline treatment. She received no specific care. And on the 15th of January 2022, at 6:30, Amina died. In the first 3 months of 2020, the World Health Organization estimates nearly 6,000 were hospitalized because of coronavirus misinformation. How many Aminas are there? How many Aminas must there be for ambitious action to take place? Disinformation refers to the deliberate, organized, malicious attempt to manipulate through dishonest information. I've witnessed how lies about the virus have harmed lives. Fake news perpetuated the belief social distancing measures were ineffective, that vaccines encroached on civil liberties, and that certain ethnicities were either immune or more likely to spread the disease. This has frequently hit and surpassed at the peripheries of what is hate speech. My friend, an Asian medical student, had people yell at her in stores. She had patients refuse to be treated because of a belief Asians carry the virus. These examples are not disparate from the scope of local and regional authorities. To the contrary, in many jurisdictions, disinformation has led to delays in enacting health provisions. The Congress should therefore act for 4 reasons. From my story, you'll see that foremost there are real-world consequences. Outside of the medical sphere, the decline in trust is damaging for democracies. The organized efforts to disseminate false material permeates into public opinion and electoral discourses. This has led to discrimination and inflammatory hate speech to be perceived as fact. It has normalized prejudices, created scapegoats, hardened an us versus them mentality. Across states, it has gone further by being used to incite violence and crime targeted at ethnic minorities. Second, disinformation is aided and abetted. Algorithms that otherwise curate search results promote misleading, sensationalist and conspiratorial content over factual information. These are the key vectors, amplifying the spread and must feature in strategy even at a local and regional level. Third, children and young people are especially vulnerable to the risks of mis and disinformation. On the one hand, exposure to social media provides a constant, almost inescapable environment. On the other hand, the pandemic has compounded existing challenges of education, of employment, of mental health, and of disposable income, or the lack thereof. This has disproportionately affected us as young people through receptivity to harmful content. However, children and young people are the greatest asset in countering the effects of disinformation. They can contribute to online fact-checking and myth-busting initiatives. Equipping children and young people with critical reading and thinking skills will assist them in determining the veracity of information. The Congress has supported initiatives, but it can go further. As delegates, what can you do? You can play an active role in correcting the record of misinformation. This means setting the record straight. Authorities should then invest in their young people. It should consist of financial support for news literacy programs, but also require investment via the opportunity and agency. I call on delegates to promote age diversity in public consultations to reflect the needs and concerns of different age cohorts in decision making. And third, authorities must engage directly with technology companies to amplify concerns at the local and regional level. In my speech, I've outlined the changing nature of mis and disinformation, how it detrimentally affects children and young people, and the recommendations I call on the Congress to consider. Delegates in this room, You have the ability to act. I held the hand of Amina 3 days before she died. I told her she'd be okay. I asked her to put her trust in me. Disinformation isn't arbitrary or victimless. It led Amina to feel paralyzed with fear, loneliness, and an inability to act. If taking the time to act can save a life, is it not worth trying? Thank you, ladies and gentlemen.